we're all different. We all, like, if you look at Kenya, we're very blessed. You can, like, there are different kind of people, different kind of features and stuff. So you accept who you are because it's not your body that makes you. Every surgery has a risk. You look at the trends of plastic surgery, what people are doing. You look at the many Instagrammers or influencers in social media, and you find that people want to look as good as they do. So they'll come here and say, can you, like, make me look like that particular person, or almost like that particular person in terms of their body form and shape.
Plastic surgery is a quick fix, though.
I can't say it's a quick fix. It's a good fix.
Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Welcome back to another episode of Daktari Tone podcast. And with me, I still have Dr. Were Andrew, our board certified. Hey, that was really, it's like I don't have just say plastic surgeon. I have to add that. I feel the need. I have to add that. So anyway, yes. But we're really glad for you to have us here.
Yeah.
And of course, the place, I've not had much time with the place, but I can still feel the warmness around it, the aesthetic, the perfectionism in it. As much as perfect doesn't exist, I stick to perfect doesn't exist. And now, yes, picking up from where we had left from, we were going to discuss on trends and demand. And now my first question to you is on social media. How does that really, influence the demand of plastic surgery, reconstructive, all those terms? Yes.
So what you've seen actually in the last 10 years or so, they've been upscaling of use of social media by the public, and that has also, like, increased the number of plastic surgery cases we see. So how it influences is very simple. You look at TikTok, you look at the trends of plastic surgery, what people are doing. You look at the many Instagrammers or influencers in social media, and you find that people want to look as good as they do. So they'll come here and say, can you, like, make me look like that particular person, or almost like that particular person in terms of their body form and shape, and we're able to do that. So majority of the plastic surgery clinics actually do advertise the services in social media. So it has also been an avenue through which we reach most of our potential clients, not in Kenya only, but all over the world, where they're able to go there, see what you're doing, whether it's a joke you're doing in TikTok, and then connect with us, and we're able to do the surgery as effective as possible. So it's been a revolution for plastic surgery that has actually driven the upscaling of the demand of the services, and I think it's something that if it's switched off, it's like us as plastic surgeons operating in the dark.
Okay, you've mentioned very, the social media platforms that are very common. Actually, they're very social. That's the best term. Instagram and TikTok. Between the two, which one do you think really has, led to?
Different markets respond differently. I can say Instagram is our main page, because it serves both the market that we target and also the younger generation who are most on TikTok. But you find people who are able to afford the plastic surgery services, if they're paying from their own pocket, mostly on Instagram and Facebook. Yeah, so we use mainly Instagram, Facebook, and also YouTube for educational material, and also to reach our patients, educate them what they need to do. So the more impact is on Facebook and Instagram, and for the younger generation, let's say below 30, we find them on TikTok.
Talking about the younger people, are they now more, seeking the services?
Yeah, yes, we have seen of late, it's very interesting because of late we see the below 25 and 26 coming in. Of course, they must be consenting age.
I was to rephrase the question, and other than just asking younger people, because I think it's wrong for me to assume that younger people were not coming before. I'd like to rephrase the question too. What ages, like if you could give it, like, the way we always sign that paper, we always say 25 to something. So if you could give the most, group or that come for the services right now, and also now touching now on the younger ages, and
So,
the consent, of course, and everything.
So of course, consenting age. I think the youngest patient I've ever done was a 14-year for a breast reduction, but of course that they came with the mother. Because of that, what we call pubertal gigantomastia. It was affecting her school, her image.
Is that like a disease? Okay.
Yeah, that's like a disease. Yeah, but
can I talk to you about it later?
Yeah, we can talk about gigantomastia because it's very common. It's affecting a lot of women. But then you find guys who are on TikTok between 20 and around 27. And these, they come mostly for facials, for face surgeries, the Botox, the fillers, the lip surgeries. You find them mostly on TikTok. And of course, one or two who will come for the skinny BBLs and stuff because of some of our people we work with who are on TikTok. Then 30, above 35 to 40 people, you'll find they come mostly for the breast reductions, breast augmentations, lipo 360, and this is mostly after motherhood, most of them, or after weight loss procedures. Then they're able to come to a procedure and we're able to attend to.
Talking about this, also money comes in, and I'd want to avoid it, but within your own free will, because of course these procedures don't sound to be very cheap. But then let me not just assume again. So are they affordable? Because I'm still in that age gap, and maybe I might be interested. You never know. But then maybe I'll be like, well, I might come here, and there's a part where you talked about USSD dollars. I'm like, oh God, no way.
No, the plastic surgery services in Kenya are affordable, and those prices guarantee you safe, effective surgeries that you can actually come to a place and go home without cutting any shortcuts. And the beauty about it, we also have payment plans where we work with you and agree that you can pay until you reach the amount of money. Let's say you say for the next 6 months, and you're able to do a surgery very well. Of course, people normally think plastic surgery is into the millions and stuff. No. As low as 150,000, you can get a plastic surgery procedure.
You're saying it just as low as what it...
As low as let me put it, Botox. Maybe you can get Botox for the wrinkles for 50 to 60,000. Yeah. So
Okay. I don't know. Do we have young people coming to like get their wrinkles?
Yeah. We have baby Botox where we use little amounts of Botox, very dilute, to address wrinkles. We have people who have hyperhidrosis, which is basically sweating a lot in the palms and the under. We use Botox to treat that. So we have younger people coming for that. We have younger people coming for breast for augmentations and reductions. So we find that's what they come for mostly. But then mommy makeovers, sculpted calves kind of procedures are then done by more older patients at 5 and above.
Okay. With the little or much time that I've had with you, the next question, I'm like, will you even have an answer for this? But then I'm just going to shoot it. So what is the strangest and the funniest request you've ever received? Like, do this for me, and you're just like, huh?
To date, strangest or funniest request, I have to think about it because for us, how we review it, any request that comes from a patient, we value it, and we consider it. If you can think it and it's something that is doable, then we're able to do for you. I think it's not strange. It happens. It's just that we don't do as many. But I think...
But I'm still going to hold you to that question.
But one that I got, I didn't consider it strange. Maybe from a lay perspective, layman perspective, you may think it's strange. But this is a patient who had surgery and lost one of the and lost one of the testes, or what you call balls. So what happened is he wanted to have what he lost replaced so that he can have at least two of them. So it's something that you don't do often, but you have done it at least here in Kenya. So we had to order for a specific implant to actually reconstruct the part of his manhood. Yeah, so that for me was a bit strange initially, but then if you read in the social media, it's something that is done more often. Yeah.
Okay. So before I go into the next part, I'd like you to ask me a question.
Yeah.
And please don't ask me very hard questions. In between, I've been trying to avoid the big words you've been using.
Yeah.
Please be kind.
Yeah.
Yes.
So if I'm to ask you a question, it's like, what will you want us to do for you?
Tummy.
Tummy.
Yeah.
Yeah.
Yes.
Why tummy? The gym, diet.
Okay, let's be honest. Gym is not for everyone.
Yeah.
I have tried OMAD. I have tried. I eat healthy.
Yeah.
I can say I'm a very healthy
Cautious
eater.
person,
Yeah, not cautious, but eater. Like my lifestyle choices in foods. Yes, I'll have cheat days one day, but then it still doesn't work. But then also, I also think I suffer from, occasional the bloating. Because some days you meet me, I'm almost flat. Some days you meet me, it's like I'm 2 or 3 months pregnant. And I don't know. I don't know if it's the bloating issue or I just have.
Yeah, I think what you need to do is get checked first, maybe by a specialist called a gastroenterologist. Maybe you have something called dyspepsia, which is an indigestion issue. And then, then after that, you'll have a better picture.
Now,
whether you need it.
That even gives me a good ask now for you. Would you meet someone, like let's say, just from the question, it's inspired from the question you've asked me, because you've asked me, if you were to come, what would you want us to do for you? Now, have you ever been in a situation where you look at someone and you're like, this is a potential customer, and maybe I would suggest this and this, let them come maybe to get this done?
So it depends on the setting that you meet, the social setting that you meet. If it's most of the time when you in the social setting, and most of my friends meet me, they know what I do. So they'll get into that conversation. And I've had many surgeries from that. Just talk during the social settings. But I won't initiate it. Unless I'm just joking with one of my boys and telling them, hey, guys, I think it's time you see me at the clinic. Maybe this tummy is becoming too big and we can do a liposuction for you to make you look better. But most of the time, it's the potential clients who initiate the questions. But I won't go there digging. It's like, hey, your nose look crooked. Can you come and see me in the clinic? Someone may look.
Because now this setting, I'm allowing you to look at me and be like, I would want you to do this. What would you say?
Of course, definitely a 360 lipo.
What's that?
Liposuction of your lower part of the body. And maybe an arm liposuction, just to make them a little bit smaller. And maybe a Botox for the wrinkles.
I think I have the laugh ones, maybe. I come from a family where we can have even like literally small bodies, but then we have like our arms are really, I don't know if is it a diagnosis or something? Like where your arms are like, they're really conspicuous than even your, because even my sister is really like small bodied, but you find that her arms might be,
Let me not be, it's an ethnic feature. It depends where you're coming from. So you find some communities have that, some don't. Or it may just be you're born like that. And it's not like a bad thing, but it's something that if you feel uncomfortable, we can sort it out.
That's actually when you asked me that question, I was like, if you asked me this 10 years ago, that would be my first go-to. But then I had to grow into it and be comfortable with it. And of course, I even got a backlash from a lady from Instagram. Actually, I posted a video and then she came inbox and she even commented and then came inbox and she was like, you're having so thick. She called it there's a word she used that was so. I didn't even want to give. I didn't even want to give her my attention. I just deleted it, and then from that, I think that's why I even got my strength to start accepting myself. And even if someone mentions it, actually before even someone mentions it, I do it myself. But yeah, I don't know why I'm even asking that question is now if you could say something about, body images issues and shaming and all that. And of course, one thing that even did stand out from our conversation is the fact that if someone wants it herself, for herself, okay, I'm talking for, I know I'm making it more of she, but I'm she anyway. But that is something that is much better for you to do. So
What I believe, not even as a plastic surgeon, is we're all different. We all, like, if you look at Kenya, we're very blessed. You can, like, there are different kind of people, different kind of features and stuff. So you accept who you are because it's not your body that makes you. But then, as a plastic surgeon, if you feel that I'm not really comfortable about this or this is bringing me undue attention, then we're here for you. But I won't be a proponent where now to encourage people to look at your body and start characterizing it so that I can get you coming to me. No, I believe we are all unique. I'm a man, I'm different from other men. I know girls say tall, dark, and handsome. And stuff.
If you could, talk about what was it? It's really Emenda, like Emenda Ivor, and it was a really good thing I wanted to ask. Now I've got it. So, if in your own honest opinion, because again, when I was still in that moment where I was, struggling, I would go in deep into, of course, you'd run into what other people are doing. There was exercises for the arms, you'd have the bells, but you find that it's time consuming for you to even get there. And another thing is not that I ate and found myself like that. And that's why at first I even said gym is not for everyone. Actually, I'm not for gym because I'll still go for it and I'll still be at the same place and same like I'll be like I'm doing everything right, but then this is just not happening. So with your own advice, because at the way I'm sitting at and with the conversation I've had with you, I find plastic surgery or the reconstruction being more of a fast, like it's not time consuming. It's something that gets what I want done. Yes. So would you rather advise me to do that or fast, because of course you've had these questions. Eat well, do this, you will get the flat tummy. Go drink this, do this. We've done all that. I see nothing.
So for us in Fine What We Do, we have an holistic approach where we combine all of that. So like first of all is the mental aspect, accepting who you are. And then two, we can do this if this particular image you feel is uncomfortable with you. And then after, we work with you to ensure that you maintain that particular thing. Because sometimes you do a surgery and we find it recurs, as I mentioned earlier in the talk. So we have a holistic approach. You're not just like go to the gym and do this and stuff. And sometimes I'll tell you, if you've had like 2-3 kids, you have a FUPA, and you're trying to hit the gym and it's not going away, you've done 1 or 2 years, you come to me, I'll be very honest with you. I'll tell you the reason why it's not going away is because when you had the pregnancy, you had something called rectal abdominis muscle diastasis. So your muscles expanded and they did not go back, and they can't go back unless you get some plastic surgical intervention. So I'll explain to you and tell you, if you get that, you get your snatch body back, and I'll want you to continue to the gym to ensure that now you maintain the result. So I'll be honest with you and I'll tell you this, whether you go to the gym for a year or 2, it won't go away. This is the solution. Let's do it, and then let's work together in your post-care journey.
But only plastic surgery is a quick fix though.
I can't say it's a quick fix. It's a good fix.
Ooh, okay, that sounds better. It does sound better. But again, as much as it sounds better, you still mentioned risks. I don't know. I don't know. It wasn't part of it, but I would still want you to talk about the risks of going through it.
So the first thing for mitigating those risks is board certification for the plastic surgery. I still insist on that. Not everyone outside there who can do a surgery has the proper training, the length of training and experience to actually do the surgeries in a safe manner. So you find that to mitigate, every surgery has a risk. whether you're doing, let's say, just even a cesarean section. We have had bad outcomes from those surgeries. Or you're doing something as simple as removing, let's say, a back mass. It can go. So how you mitigate that is to ensure that you, first of all, is the facility that you're going licensed by the regulatory body? Is it being inspected? Is it safe for you to do that kind of surgery there? So what are the precautions do they take when the surgery is done there? And if something goes wrong, what are they going to do? So those are questions that we encourage your patients to actually ask when you go to any facility. Don't just go to a place, you enter a building and you're told, oh, this is your bed here by the corner, this is the theater by here. You have to ask yourself, in case something happens here, will I be safe? The second thing is always look up in the social media, in the medical council website, who your plastic surgeon is. So are they registered? Are they people with good reputation? Are there cases that are going on with them? Of course, as a surgeon, I can't lie to you, I'll be a customer for the medical council because not everything that we do goes 100% right. But the question that you normally ask the patients, and the patients should ask us, is if something goes wrong, you get a complication, which is the basis of the consent you give a doctor, then what next? What are you going to do to ensure that the way I walked in here, that I can still walk and be with my people back at home? So those are the things that you need to look at before you then take that decision to do a surgery.
Since we're already there on safety, ethics, and regulation, so what policies and regulations would you recommend to reduce botched surgeries and protect patients as well?
So for protection of patients, I think the most important thing, first of all, is getting the right plastic surgeon to attend to you.
But then, before you move further from that point, how would I know this is the right plastic surgeon?
So we have the Kenya Medical Practitioner and Dentist Board, which registers you and gives you a license to practice as a plastic surgeon. The second thing, the associations that exist. We have the Aesthetic Society that represents surgeons who do cosmetic surgery.
Again, I'm sorry to cut you short. So let's say in the media space, for example, we do have like an MCK number, or even I've also seen it in Cambry. They also have like a number and also like a fast number that you can just print in the number very fast, and it brings you the details of everyone. Just say like Rianke Rubo, media station, where and where. So for doctors, let's say I'm here, I'm your patient, I'm looking at you. How will I really know that Dr. Were is truly a certified plastic surgeon?
We have the same unique numbers. You can look into the Kenya Medical Practitioner and Dentist Council. It will show you my name.
Then where will I get the number?
I'll show you the number. And of course, most of the time before you take the decision to do a plastic surgery, just do a research, do a background research, Google my name. It's all over the internet. It will show you where is history, what he's been doing in this country, what kind of surgeries. Then I'll give you my number, look it up. Our facility has a unique number. Look it up, and the board will tell you this is a plastic surgery center. We have licensed it to do that. The other thing we normally ask the public to know is go out and see, is this plastic surgeon associated with any associations? Because associations are normally the ones who keep the vault of, or are the keepers of the professional practice. So if you're associated with Aesthetic Society, as I said, which is Aesthetic Society of Kenya, it represents cosmetic surgeons, plastic surgeons, it represents cosmetic dermatologists, it represents cosmetic GPs who do Botox and fillers. So when there are members there, then we have a set of rules before we admit you into the society. We have a set of rules which you have to follow, our code of practice, which ensure that you are a member. We have continuous professional development that we do provide, ensuring that you are always updated in terms of skills and knowledge to be a safe doctor for that particular patient. So once you do that, and then for us, we're normally very free. We have patients who have done the surgeries here, who can actually then even give the testimonials. When you want, we tell you, oh, talk to patient X, she'll tell you how our journey was.
Other than just even getting the testimonials from talking to patients, because of course that also is gonna wreck privacy. Do we have like the testimonials, like when I search, of course, we'll have some comments.
Yes. So you go to Google, you find the Google reviews. They're there. Just like when you're booking a hotel, you find the reviews. There is the same thing. You'll find the reviews. And the Aesthetic Society is a very robust website where we encourage our members to post testimonials there. Because now that is independent. It's not linked to the organization. So before you post, then it tells you who we are and what we do and how we do it.
Okay, now back to policies and regulations that you'd recommend.
Of course, for me, as the president of the Aesthetic Society of Kenya, we are in the process of developing protocols for every cosmetic surgery that we do, which we are going to share with the public, so that even as you come to the facility, you're able to see that for me to do, for example, liposuction, I need to do an ultrasound to just check whether I have a hernia or not, because that can be a risk. I need to do this blood test, then this is what I need to do as aftercare. So those things, we are going to print them and put them in our website to be accessible to the public, together with now the list of our members who are there and where they work, and they can even post their cases. And then the other thing is the public education. Educate, educate, educate. Say it again and again and again. Only go and work with people who are board registered by the Kenya Medical Practitioner and Dentist Board, who are members of the Aesthetic Society, because then like they are together, there's continuous professional development, they have skills, and they mean no harm.
So I believe you've also answered, but today you're too forward, which I think it's a good thing. But just to get it out there, I'll still ask it. I know you've already answered it, and then I'll get to say it how I've understood it. So the question was how you ensure ethical practice and patient safety in your work. Of course, talking about refined plastic, And one thing that really stood out for me is the fact that even when I come in, with the way you were talking, I was already feeling being your patient from this other end. And I was like, you're already telling me, let's say if this happens, I really felt safe before you even told me the safety, procedures and all that. But then that also leads me, as much as, yes, what are the safety, afters when something goes wrong? Yes.
So of course, for us, before even something goes wrong, we practice evidence-based kind of plastic surgery medicine, where, for example, if your surgery is going to last more than this number of hours, then we ensure that you have, let's say, a pneumatic stocking that will help the blood flow, so there's no clot. Afterwards, we put you on blood thinners if it's a tummy tuck to ensure that there's no clotting. But in that circumstance where something goes wrong, then we respond to it on a timely manner, where we're able to take care of you, address that particular issue. We are linked to hospitals where I have admission rights in Nairobi, where if you need further care, then you're able to take you there so that you're well taken care of. But since we've been here for more than 2 years, we have never had any incidents that will warrant that, because we take a very proactive approach in terms of patient care and patient safety. So we do not wait until something goes wrong. We try predict and ensure that then we're able to handle it before it goes wrong.
Okay, great. So I think I'm going to just go directly into now insurance, because even when I got in, what was in your mouth outside this was this SHA. And of course, we've already talked about accessibility and all that, but then still insurance is still a thing, because we have those who are not able to, they still need help to get these procedures done. And even with the transition from NHIF and SHA and all that. So around that, that's where now this conversation is going to be based on. And I would like to have your thoughts on how you would, have the Social Health Authority, being part of the journey of plastic surgery and aesthetic and cosmetology and all that. Yes.
So, but unfortunately, if I use those two words, unfortunately, cosmetic surgery is an exclusion worldwide by insurance, because it's not a risk that is going to occur. it's something that you choose to do.
Yes.
So they can't cover, insurance cover against a risk. So you'll find they don't cover most cosmetic procedures. The only time they come is when it's a reconstructive procedure. And from SHA to all other major insurance covers, they're able to cover that as part of plastic surgery, and we're able to provide that service to the public. So the only thing that I find challenging, and where I find actually women are denied this care, is when we have the issue of gigantomastia or very big breasts.
Okay.
Yeah, because gigantomastia is a problem that many women are having.
But probably used another term. The one for
breast hypertrophy or macromas, pubertal, they're the same thing. Pubertal gigantomastia. So it happens when at puberty, then during pregnancy, and sometimes after pregnancy. That's how it's classified. But it's a problem that we have here. We are not like Europeans. You find we are a bit huge. So you'll find the breasts are bigger. They have a lot of weight. They cause postural abnormalities. You'll find you have breast pain, shoulder pains,
Yes.
and breast infections. But then you find when most of these women, mostly in productive age, seek care, then most insurances think since they've gone to a plastic surgeon, then it's a cosmetic. No, it's not. And we have data that can actually support that this is actually not a cosmetic procedure, and it's actually a disease that needs to be handled, because the change that it makes, just as a woman being able to do a simple thing like jogging and running, yeah, which if you don't do, then you'll have maybe a sedentary life because your breasts are too heavy. You get diabetes and hypertension, which still this insurance company will have to pay for the cost. So I think in terms of preventive and curative medicine, is something that we need, the insurance industry needs to look at. It was done in America, where there's now policy in place, and even in Canada, that if I do that particular surgery and I'm going to remove more than 500 grams of tissue per breast, then it qualifies to be a medical condition. If I do that surgery and I'm going to remove less than that, then it's a cosmetic. And when you have an environment like that, then we have our women actually having to access this service and actually to live a normal life. Yeah.
Okay. But then now the good question is, how would you see SHA support these necessary medical, needful procedures?
Yeah. No, SHA actually does support. It does pay for most reconstructive procedures. Actually, SHA is one of the only insurances that pays for breast reduction without a lot of ulabaloo or second opinions. And what I find very strange is, as a plastic surgeon, an insurance company sends to a general surgeon who doesn't do breast reduction, it's outside their scope of practice, to give a second opinion whether that surgery is necessary or not. Yeah, and I think that's a trick that's been used to deny many women the surgery that they do deserve. So SHA is one of the actual insurances that covers for that. It covers for skin grafts, it covers for wound issues, cleft lip and palate. So I think they are a leader in terms of actually supporting reconstructive plastic surgery in this country.
Okay. Now you had mentioned something really interesting, the fact that it's worldly, global, that cosmetic, surgeries are not supported by insurances. But then do you think insurance should support some or any, especially if it's maybe coming down to the mental toll of the patient, because mentally ill is still ill?
So there are some insurances that support, we call them weight loss surgeries. Or in countries where we have an epidemic of obesity, which we are starting to see in our country. Yeah, so they support that treatment, but then you pay extra. And we hope that our insurance companies can be able to come up with such packages, ask the patients to pay maybe an extra amount of money, and then they're able to be covered for those surgeries, because it's something that you just do once. So it's not something that you'll be doing every year. So I think that, together now with other companies that are coming up where they're providing credit to these individuals or these clients of ours who are able now to access the service.
With the few gaps that you've mentioned, now what other policy gaps do you feel that needs to be addressed towards accessibility and even affordability for this service?
Yeah, I think the other policy gap, it's basically trying to remove the taxes from equipments that are used to provide these services. Because you may say, for example, plastic surgery is expensive here because we have a lot of tax on those equipments that we use, which makes us now charge more. Contrary to other countries where, like the Turkey, the Mexicos, where they're able to get those equipment at a cheaper rate. So we're having our patients going there because they're able to provide those services sometimes. They say it's cheap, but it's not cheap compared to what we provide here, but they're able to go there and we still lose money as a country. So it's better, instead of that, having that dollar flight from Kenya, we look at the taxation of the equipment that we use in our surgeries. Because at the end of the day, once you're on my table, you're a patient. You're not a cosmetic patient, and then this is a sick patient. You're a patient. So the patient advocacy group should look at this and see how we can lower the cost of doing the surgeries here. But still, it's way, way cheaper to have a mommy makeover here than to fly to another country and have a strange surgeon operate on you, and then you don't know even about the aftercare. Here we operate and we take care of you until you heal.
Now, a fun question. If you could design your own insurance package, what surgery would you include that would surprise people?
A mommy makeover.
A what now?
A mommy makeover. So a mommy makeover is surgeries that we do for mothers after giving birth. Because, of course, there's the...
You're a daddy.
Because you already know that the
from the beginning of this conversation, we've just been talking about, giving birth, moms. Wow.
Yeah, but you imagine you've given 3 to 4 children, and you need your breast done, your tummy done, a bit of vaginal rejuvenation to be done. It's a risk that is going to occur, because a mother, if is married, or even if they're not married, a woman will give birth. So I'll design a product to cover them, because there are many, and the insurance industry will make a lot of money out of that. That's a tip. Don't share with them.
It's already out there. Anyway, whoa, that's a mommy makeup. That got me, honestly. I hope by the time I'm becoming a mommy, that will be there.
I won't say which kind of insurances to take. That one we can talk behind the tapes.
Okay. Sure thing. So you've definitely made this so short for this segment, honestly. Again, you were too forward, which was I said it was a good thing. So that's it for this episode. And in the next episode, you're going to dwell in Dr. Were's memorable parts, where, outside from the operation room, what are those parts that make him? See you next.